There could be 6 million new HIV infections and 4 million more AIDS-related deaths globally by the year 2029 due to the sweeping aid cuts by the US. That's according to the UN, which is releasing a report on global HIV infections today, its first since the cuts took effect. It's being announced in South Africa, the country with the highest number of people living with HIV and home to the world's leading HIV researchers, whose work could be set back years as a result of the US actions. Here's our Africa correspondent, Mayeni Jones, in Johannesburg on the global impact it could have.
A lifeline for thousands. This private clinic in northern Johannesburg used to receive USAID funding. We visited when the cuts were first announced. And some of its patients were anxious about their impact.
Firstly, when I was sick without the clinic or attending the clinic, my life was so bad. Since I get the treatment from Vetkopen Clinic, I'm fine. I'm fine. There is no problem about me.
What would you say to Americans who say that American taxpayers shouldn't be paying for healthcare in South Africa?
No. That is not a good idea. We are all human beings. They mustn't separate. This is Africa, this is America. Please.
Although this clinic is still open, dozens have closed their doors. Scientists here are warning this could lead to a spike in infections. The public health system is stretched and can't absorb all the patients who used to get their care from USAID-funded initiatives. And frontline healthcare isn't the only affected area. These scientists are working on a vaccine for HIV, but most of their funding came from the US. When President Trump pulled the plug, they managed to secure some emergency funds, but it won't be enough.
When the stop order came, that meant we had to stop everything, and it's only been some of us who've been able to get additional funding that we could continue.
How disruptive was that interruption?
Extremely disruptive. It's set us back months, probably could even be a year or so.
The benefit of developing and testing vaccines on the continent is that it makes them cheaper. Following the US funding cuts, some of this work may now have to be completed in the US or in Europe, where vaccine trials are more expensive. This might mean that any vaccine that's developed could be unaffordable. Many of the developments in HIV prevention, which have benefited patients around the world, were trialled here in South Africa. Now the country's researchers say they need emergency funding if this work is to continue.
South African researchers were the ones who did the pivotal trials on a lot of these treatment regimens, a lot of the HIV prevention tools and drugs, but we're not on top of HIV yet. We're only managing HIV, we're not preventing HIV. So it's still there. We still need a vaccine against HIV, and that's where we need to continue doing research.
The South African government and international donors have pledged some $54 million to plug some of the US funding cuts. But given that last year the Americans spent $450 million on HIV funding to South Africa, this bailout won't be enough to cover the need. This could have devastating consequences for global health. Mayeni Jones, BBC News, Johannesburg.